Welcome back to our program, Talk of the Town. With me now to close out our show are the Nagels, Dr. David Nagel and his wife, Becky, who are volunteers with a phenomenal organization called Volunteers in Medicine. And they are volunteering and have been for the last 5.5 years right here on Hilton Head. So it's good to have you with us to kind of share with us your experience and really what VIM is. Many people on our island know and have heard VIM, but don't really know what it does and the services that it provides for the underserved. So thank you for being with us.
Welcome.
So let's start with you, Dr. Nagel. David, may I call you David?
Sure.
So you were formerly a radiation oncologist. You're now working in general medicine. So why do you do what you do?
Well, I enjoy it. I loved medicine. I didn't really want to totally leave medicine after I retired. And Becky and I both found out about VIM from a number of people on the island, and as soon as we discovered it, we really liked it. And it's been a good part of our life down here.
So for those that don't really know what goes on behind the walls, what is Volunteers in Medicine, and what services do you provide to the community?
Well, it's a volunteer medical clinic that started probably about 20 years ago for patients that did not have health insurance. And it's been a great service because we have many patients that either people that live on Hilton Head or work on Hilton Head. They have to meet certain income requirements, but that do not have any health insurance. So for them, it's great. It provides a large amount of outpatient medical services, provides pharmacy, medications for them, dental care. Yeah.
And what about eye care? Is there eye care also as well?
Yes.
Yes. And so, Becky, you were a nurse, former nurse, but you are now serving as an interpreter. A lot of Hispanic needs there.
Yes.
So how are you enjoying it, and really what is your role, and how often do you volunteer?
I really enjoy it. I love the people and the patients, and also everyone that works at VIM. It's just it's a nice place to work. I've always enjoyed helping people that are sick, and this gives me an opportunity to be with the patients to help them communicate from when they first come in and when they need to communicate with the other volunteers or staff members, and then as they leave.
What would you say are and either one can answer, some of the greatest challenges that the patients have medically? What would you say some of their greatest?
I mean, we see a wide variety of problems. It's, and we provide just about everything. I mean, women's health care, pediatrics, vaccinations. We've given, I think, about 1,500 COVID vaccines to patients since they were available. Just about everything you can imagine. And the nice thing is, and dentistry, of course, the nice thing is, too, that we provide medications for patients. So when they leave the clinic, probably 90% of them actually have the medications they need in hand.
Wow. During COVID, there was a lack of volunteers, and the clinic went from walk-ins, and of course they had appointments and walk-ins, to just appointments, and just really had to kind of confine their services to just a few hours a day and so forth. So how are things going now that we're sort of coming out of the pandemic?
Things have come pretty much back to normal. I mean, we went through various phases. Initially, we actually had to close the clinic for about 2 months. June of last year, we opened it back up for existing patients. And then finally, when we started to get our volunteers back, many of whom fell into sort of high-risk categories, when they started coming back after vaccinations were available, then we were able to start seeing new patients again. Right. And now we're pretty much back to normal.
Okay, and Becky, if someone is thinking about being a volunteer but really doesn't know really where to turn or really what they could offer, what advice would you give them?
They could always just contact Dottie, the director of volunteers, and you can even take a tour of the clinic and just speak to as many people as possible. But it's just a really nice environment to volunteer in, and
it's very professional. Yes,
it is, but it's also very pleasant, and the patients are so grateful, and it's just it's a good place. It's a good place to volunteer.
So you can be a clinical volunteer or a non-clinical. I actually was a greeter back last fall. So there's something for everyone.
Right.
And always in need of physicians. I know that.
Yeah, in need of everybody, really.
Really.
Yeah.
Thank you so much for being with us. I know the interview was short, but the need is great.
Thank you.
Thank you for your volunteerism. And thank you all for watching Talk of the Town for this edition. And we'll see you next time. Bye, everyone.